The sound is a giveaway, right? For a lot of kids, there is other limiting factors like speech impediments and speech issues with certain syllables. That's often a giveaway. For a lot of infants, it's actually breastfeeding that tips mom off because it's painful. It's difficult for the child to feed well. So those are some early signs that they have a tongue tie. For my son, when he was born, the minute I held him and he took his first breaths and started crying, I was able to see that he had a tongue tie to the tip of his tongue and he could barely move his tongue. So at 3 days old, I took him into my office and I lasered the tongue tie free. And he immediately began to feed better and he got calmer, started sleeping better. So we've seen that from every age range. But for the most part, when parents are not, they're not having some kind of feeding issue or they're not having some kind of speech impediment, many times it goes unnoticed. I know a lot of pediatricians don't look for that. Unfortunately, it's skipped a lot of times, but it has a very large impact on our facial development and also has a large impact just on the function of how the mouth grows, the dentition, the smile, the joints, the things that we mentioned before. So one of the best ways when a child is 4 or 5 years old or older is to do a functional limitation test and to actually see whether or not it's holding their tongue back from functioning in the right way.